Justin Plowman is a program coordinator from Aurora. He works with over 200 companies in southeast Wisconsin on worksite health screenings, health risk assessments. He's been in corporate health and wellness for over 15 years and is an excellent example of the workplace facilitator that you folks in the hospital industry bring to your marketplace. So with that, Justin, I'll turn the floor over to you.
All right, thank you, Gavin. Good morning and or afternoon, depending on where you're calling in from. I do work for Aurora Healthcare. For those who don't know about Aurora Healthcare, we are the largest inpatient and outpatient hospital system in the state of Wisconsin. We have about 15 hospitals, over 150 clinics, and we are situated in over 30 communities, stemming basically the eastern third of Wisconsin and now even into the northern part of Illinois. Currently, we have upwards to 30,000 employees that are employed by Aurora Healthcare. So the department I work with is a division of Aurora Healthcare. It's part of Aurora Wellness Solutions model that we help employer groups in our service market lower their healthcare costs and help keep their employees healthy. So in 2011, we were looking for opportunity to expand our operations to improve our HRA product, and we did have many vendors come through, and by the end of it, we decided that U.S. Health Center is by far the best fit for us. We found that their predictive modeling and their way that they worked with us as far as being local, they're right in our service area, their home base, so that made it very easy as well to work with them directly. So they've been a very great partner. So we do use them in a variety of different ways. We do use them for obviously the HRA product that Gavin did speak about earlier, but also we use them in, as part of assisting in our phlebotomy screenings, both in the service market that we have here as well as national, when we have a national satellite location with any of our local companies. So we use their coaching program as well as their full online experience. So we are currently servicing about 40 customers with U.S. Health Center, and some of them range as small as 10 employees and some all the way over 1,000. So, and we are currently working with them in over 20 states. So I'm going to talk a little bit about a couple of our clients that we do work with them with. Number one, it's a manufacturing client that's in our southern market in Wisconsin. They're a manufacturer of conveyor belts. They're a leading manufacturer in the world, actually, of conveyor belts. So if you see a conveyor belt, there's a good chance it comes from this company. We have been working with them as a department since 2010. We used to be working with them with a different HRA vendor, and what we had started to see is that over time, the improvements in the overall risk and then the participation levels really started to drop off. They weren't being engaged much. We were identifying risks with the report, but we were not identifying what those risks really meant. And so we felt that we wanted to try to transition them to the U.S. Health Center HRA, and in 2014, they came on board, and we are now going to be working with them into our third year in 2016. Now, this company does have about 300 lives in the Wisconsin area. We did last year pull in about 69% of their workforce. A little caveat to that is that the incentive with this group was an insurance reduction off their premium. So we did reach over almost 95% of those eligible participants. It's about 70% overall. So when we were looking back and seeing that risk trend kind of drop, we instituted a kind of a 3-year strategic plan with them. Year one being that we wanted to kind of slowly transition them to the new HRA. They used to be paper-based with our old clients, which did not have the capability of doing online and paper. U.S. Health Center has the capability of both doing online and paper formats simultaneously, so we felt that was a great opportunity to help bring them into the online experience. And after that year one, then we rolled out in year two, which is 2015, we move them into a health contingent wellness program in which we use the Wellcentive score that comes from the biometrics to basically either give them the incentive, the reduction in their healthcare premium, but if they did not fall into the low-risk category, we gave them the opportunity to meet with one of our health coaches, either 1, 2, or 3 sessions, depending on their health risk. Based off of their participation in those 3, either the coaching or being low risk, then they did receive that incentive. So what we're looking for in this year is to even expand that more, hopefully bringing in that health counts and tracking mechanism and other on-site coaching opportunities throughout the year. So what we really use U.S. Health Center with this client is basically three things. They do help us out with the phlebotomy as well. We do have a partnership with them to bring phlebotomists on-site with our own staff. They do process those labs for us. We do use their health risk assessment, both online and paper. And then we also use that coach tracker for utilization to track the coaching that we use. U.S. Health Center, though they have their own coaches, they have been great partners to let us use ours, and our coaches do use the online coach tracker to help manage their coaching sessions with their coachees. So they've been a great partner with this one company here. And the second company I want to touch on is a little bit different of an experience, because we actually partner with this company for screenings only. They have their own internal health risk assessment, and that health risk assessment, they were just looking for a vendor to come in and do their phlebotomy screenings for them. They are a company based out of Green Bay, Wisconsin, and even though they are based out of Green Bay, they do have many other states, 19 or 18 other states, where they do house many other lives. So the problem with our limitations with Aurora Healthcare is that we really only service the people in our service area with our hospital systems, so we do not have a national presence. So U.S. Health Center, using their phlebotomists and their other partnerships with other phlebotomy vendors, we are able to still be able to service this company, and then using U.S. Health Center's assistance, be able to service the other 18 states that we work in. So we do have about 260 on-site screenings that we work with our own screeners. We get kits directly from U.S. Health Center. They send us all the phlebotomy supplies. We simply have to show up and perform the tests and then mail them in. The labs are then automatically uploaded into their HRA, so that when the employee does do their HRA, they see their biometric results right on the page. But the states that we can't reach are with our own staff. U.S. Health Center steps up to the plate, and we actually deploy about 340 of their staff hit some of these other states, that then they go directly on site. And again, everything is mailed right to the location. The site contact simply has to, the screeners simply show up with a centrifuge, and everything's there waiting for them. And then we also partner with them with what we call remote kits. So this company also has about 70 to 75 employees that work remotely, either sales staff or independently from their homes, and we actually deploy remote kits for them that they're able to bring this to any of the local clinics. They get mailed to their home. They bring this kit to the local clinic that is listed for them based on where they live, and they can get their labs taken and processed, and that too is then uploaded directly into the U.S. Health Center database, and then we can then supply those biometrics for their internal HRA. So it's been a great partnership, both for the online experience and also the phlebotomy experience. So what we're really looking at for going forward, being local with U.S. Health Center, it's been a great opportunity to really be able to meet with them in person, with many opportunities to, they've taken really a lot of great communication back and forth with the customization of our reporting. We did have a couple suggestions that we recommended, and they've been very helpful with that. We're currently working on a new revised report that we feel will fit much better with our current clients, and they've been very receptive to that. And then we're always looking at opportunities to work together on proposals and expand our partnership in our local community, since we are based out of the same geographical area, to work together with opportunities with employers, and then also those brokers that represent those employers. So thank you, Gavin, for letting us speak on our partnership, and I think we have a great future ahead of us. Thank you again.